The symptoms of heartburn are caused by the frequent reflux of stomach acid into the esophagus. In contrast to the acid-neutralizing antacids, which I discussed in my video last week, the histamine 2 blockers, or H2 blockers, alleviate heartburn by suppressing the secretion of acid from the stomach. One of the H2 blockers has been withdrawn from the US market due to the probable cancer-causing contaminant in some ranitidine products. Here, I will focus on the discussion of two most commonly used H2 blockers, Famotidine and Cimetidine. This diagram illustrates that the stimulation of the H2 receptor by histamine initiates a cascade of chemical events that lead to the activation of the proton pump, which pumps hydrogen ions from stomach parietal cells into the lumen of the stomach. The H2 blockers block the activation of H2 receptor and reduce stomach acid release by about 70%. Symptoms of heartburn can be lessened by H2 blockers when the less acidic gastric fluid flows back into the esophagus. All of the H2 blockers have been shown to be equally effective in stomach acid reduction and heartburn relief. On April 1, 2020, the FDA requested manufacturers to withdraw all prescription and over-the-counter ranitidine drugs from the market immediately. The FDA had found low levels of N-nitrosyl-dimethylamine, abbreviated as NDMA, a probable cancer-causing chemical in some ranitidine products. Because of the withdrawal, ranitidine products have been unavailable in the United States since then. If you still have any leftover ranitidine or Zantac medicines in your drug cabinet at home, you should get rid of the medicines as soon as possible by following the disposal instructions. The level of NDMA increases in the medicine with time. If you accidentally take the ranitidine product, you will be exposed to high levels of the harmful NDMA. Cimetidine is one of the H2 blockers that prevent and reduce the symptoms of acid reflux or heartburn. Tagamet is the brand name medication. Cimetidine starts to take effect within 1 hour of intake and suppresses stomach acid secretion for about 12 hours. The over-the-counter dosage is 200 mg, 1 to 2 tablets a day. You should consult your physician if you have liver or kidney disease. If you need to take this medication for more than 2 weeks, you should see your physician for further evaluation. At Walmart, Tagamet costs 30 cents a tablet, and its generic equivalent is priced at 10 cents a tablet. Because cimetidine interacts with many other medications, famotidine can be a better choice for treating heartburn, especially if you are taking other medications. Famotidine, or the brand name Pepcid, has a major advantage due to its significantly less interactions with other medications. The dosage for over-the-counter famotidine is 10 mg to 20 mg a day. Like cimetidine, famotidine alleviates heartburn within 1 hour and lasts about 12 hours. Patients with moderate or severe kidney impairment should decrease the dose of famotidine. If you need to take this medication for more than 2 weeks, you should consult your physician. The brand name Pepcid, which contains 20 mg famotidine, costs 32 cents a tablet. Its generic equivalent costs 5.2 cents a tablet. The Pepcid Complete has the advantage of being effective immediately because of the ingredients of calcium carbonate and magnesium hydroxide, which neutralize the acid inside the stomach instantly. The famotidine in the Pepcid Complete suppresses the acid production by the stomach, and the effect lasts about 12 hours. The dosage is 1 tablet once or twice a day. Each tablet contains 10 mg of famotidine, and people with kidney impairment should decrease the dose. Again, you should consult your physician if you need to take this medication for more than 2 weeks. Brand name Pepcid Complete costs 32 cents a tablet. Its generic equivalent with the same active ingredients costs 20 cents a pill. In summary, H2 blockers help relieve symptoms of heartburn by decreasing the acid production from the stomach. Because of the probable cancer-causing chemical NDMA, Ranitidine products have been withdrawn from the United States. You should dispose of Ranitidine or Zantac medicines as soon as possible. Although Cimetidine and Famotidine are equally effective for heartburn relief, Famotidine is preferred because it has the advantage of less interactions with other drugs. If you need to take H2 blockers for more than 2 weeks, you should consult your physician.